Hello, welcome to Dr. Bach Show. I'm Dr. Bach and I'm here for today for discussing about the gout. Actually, the gout causes sudden severe joint pain. If you have this kind of joint pain, initially you have to visit a GP for treatment to help during an attack and to stop further attacks. Sudden severe pain in any joint, usually the big toe or fingers, wrist, elbows, or knees. And the number 2 is red, hot, swollen skin over the affected joint. These are the symptoms of gout. Gout doesn't cause lasting damage to joints if you get treatment straight away. Ask for an urgent appointment or call 111 if the pain is getting much worse and you have a very high temperature. Something like that, you feel hot and shivery. Then this could mean you have an infection inside the joint. Now let's discuss about what happens at your appointment. Gout can be heard to diagnose as symptoms are similar to other conditions. A GP may ask about your diet and if you drink beer or spirits. You might be sent for a blood test, ultrasound, or X-ray. Sometimes a thin needle is used to take a sample of fluid from the affected joint to test. The test will find out how much chemical called uric acid there is in your body, and having too much pain that can lead to crystals forming around your joints and causing that much pain. Now let's discuss about treatment to reduce pain and swelling. Attacks of gout are usually treated with anti-inflammatory medicine like ibuprofen. If the gout doesn't improve after 3 to 4 days, you might be given steroids as tablets or an injection. So, you have to take any medicine you have been prescribed as soon as possible. It should start to work within 3 days. Next, rest and raise the limb, and then keep the joint cool. Apply an ice pack or a bag of frozen peas wrapped in a towel for up to 20 minutes at a time. And obviously, you have to drink lots of water. And lastly, try to keep bedcloths off the affected joint at night. You should not knock the joint or put pressure on it. So you need to remind that. Now let's discuss that treatment to prevent gout coming back, actually the recurrence. Gout can come back every few months or years. It can come back more often if not treated. If you have frequent attacks or you have high levels of uric acid in your blood, you may need uric acid lowering medicine. And the important point is, I have to mention in there, it's important to take uric acid lowering medicine regularly even when you no longer have symptoms. And the things you can do to stop gout coming back. First of all, making lifestyle changes might mean you can stop or reduce further attacks. So you should get to a healthy weight but avoid crash diets. Aim for a healthy, balanced diet with plenty of vegetables and some low-fat dairy foods. Next, you have at least 2 alcohol-free days a week. As well, drink plenty of fluids to avoid getting dehydrated. Exercise regularly, but avoid intense exercise or putting lots of pressure on joints. You might be asked to stop smoking, so this is the most important point. You have to stop smoking. And then ask a GP about vitamin C supplements. I'm here to mention that you don't eat a lot of red meat, kidneys, liver, or seafood. As well, don't have lots of sugary drinks and snacks, don't have lots of fatty foods, and the last one, don't drink more than 14 units of alcohol a week. And the next one, the things that can trigger a gout attack. You might get an attack if you're very stressed or have had an illness. If you injure or bruise a joint and it's more painful than you would expect after a minor bump, it could be an attack coming on. So get treatment straight away if you feel an attack coming on. Now the more important questions, most frequently asking questions, who gets gout? Generally, gout sometimes runs in families. It's more common in men, especially as they get older. Other people at risk include such as women after the menopause, the people who take medicines such as diuretics, which is known as the water tablets for blood pressure or have high levels of cholesterol, and people who are overweight and who drink alcohol, especially the beer. Now I'm discussing about complications of gout. It's rare to get lots of attacks, but if you do, you can develop permanent damage to the joint, which is known as the chronic gout. Chronic gout can also cause tiny white lumps, which refers to as stophy, to appear under the skin, especially on your ears, fingers, or elbows. There is where uric crystals form under the skin. They can be painful. You can get kidney stones if your uric acid levels are very high, so you will need treatment to reduce the levels. And something like that, if you need help with day-to-day living because of illness or disability, and if you need care for someone regularly because they were ill, elderly, or disabled, so you should seek a social care and support guide. So that's for all today about the gout, and hopefully you guys will be benefited from that and after hearing my podcast. Thank you. See you again in the next episode. Bye-bye.